I'm going to do an instructional video on how to do a syringe pump. So the first thing you do is hand hygiene. You gotta wash your hands. And then put on your gloves. This isn't a sterile procedure, so you can just use clean gloves. You need to calculate the volume that you need to administer and also look up the time in which it should be infused over. So theoretically, we're going to administer 3 milliliters and it's going to be set at 1 hour. The first thing I'm going to do is take my medication syringe and open the filtered needle, put that on. And since I'm drawing up 3 mils, I'm going to take off the cap and draw up 3 mils of air. There it is, 3 mils. Then I'm going to take an alcohol swab and clean off my medication and wait for it to dry. So theoretically it's dried. And then I can go ahead and stick it in and push in the 3 mils of air. Flip it upside down. Make sure the tip is inside the medication so you're not drawing up air. And you can go ahead and pull up 3 milliliters of air. Okay. Try to get any air bubbles that there may be out. And then you can scoop this to recap it. Next thing you're going to do is you're going to take your tubing, which just looks like this. And since it's capped, both ends are sterile. So I'm going to take this end off and uncap it. Make sure not to touch the ends of it. You want to keep that sterile. And then I can go ahead and take off my filtered needle and connect the tubing to the medication syringe. We'll make sure the tubing is unclamped. And then you want to go ahead and prime the tubing. So you can take this cap off and also, again, make sure you're not touching it so it stays sterile. And you prime the medication to try to get as many bubbles out as you can. You also don't want to waste medication, so if there's a few bubbles, that's okay, but you want to try to get the majority of them out. So this is primed. I'm going to go ahead and hold on to this. And then I can take another alcohol pad and wipe my port, the PRN adapter, and then go ahead and wait for it to dry. Once it's dried, I can take a sterile saline syringe and take off the cap, make sure it stays sterile. Put it on the PRN adapter and just flush the vein to check for infiltration. Just put a little bit of sterile saline into them and make sure that the IV is still intact. And it looks fine, there's no infiltration, so I can go ahead and take this off and attach my tubing to the PRN port. Just screws right in. Okay. Now you're ready to set up your syringe pump, so you can come over here. What I would do is I would unclamp this and make sure you're sticking it in correctly into the little space for it, like that. Just like that, okay. And then you can grab this and slide it down to the edge, like that. Then you would turn it on, and then you would set it to the time, so which is 60. And then you can hit start, and it'll begin infusing. Now, once all the medication is infused, you would take a sterile syringe or a sterile saline syringe and put it in at the same rate and let it infuse just to get all the medication out of the tubing and make sure the patient is getting all the medication they need. And then you can go ahead and unscrew the tubing and positive pressure flush and just slide the clamp or the slide clamp shut, and then you'd be done. And that's all.